We have a full house today. And because we have such a jam-packed session today, I just want to start right out and say a warm welcome to all of you today here at the Nutrition Collective. For those who don't know the Nutrition Collective, we are an educational platform, a cutting-edge educational platform for healthcare professionals, bringing you the latest research, the latest education around chronic disease. And today I'm so excited because we are presenting something that has been asked to us for such a long time by different practitioners, which is to understand nutrition-based protocols to combat chronic viral persistence. And this is being led by none other than Dr. Christy Hughes Moreland, who, as a lot of you know, is a functional medic who has over 20 years of experience, who's always wanted to understand the root cause medicine strategy when dealing with chronic disease. And she has over 20 years of experience in medical education. She's been at the IFM board for over 10 years. And recently she's joined the science member, she's become a science member of an upcoming company called Nutridyne, an amazing supplement company that has cutting edge research around their supplements. So really, really excited to have you, Christy. Welcome.
Thank you. I am so happy to be here. This is like a topic that's become so near and dear to my heart, as it's been something I've been dealing with in my practice and something in my own life.
Absolutely. And all of you will have a chance to ask lots of questions to Christy. So please dive in, get into the Q&A panel and make sure to ask the questions. Over to you, Christy.
Sounds great. Well, this is an excerpt, I would say, out of a full 8-hour day workshop and conference that I'm teaching. So there's a lot that I want to say, and I've given you a very robust set of resources today. So at the end of this conversation, what you'll find is that I've given you basically a takeaway tool and a resource guide that can help you navigate the landscape of your choices that you have in looking at nutrition implementation. As was mentioned, I think the interesting thing with Nutridyne is actually a company that was launched in 1973, which is pretty amazing. And it has now expanded into the European region. And I personally started my practice in 1997. And the week I opened my practice, Nutridyne was actually right there. And they were one of the very first companies that I have ever had the opportunity to work with. Back in the old day, 27 years ago, Nutridyne was also partnering with Metagenics and carried and holds this large warehouse, bringing in a lot of key nutrition supplementation and really servicing an amazing part of the United States and now abroad. So I've had my entire career, I can say, I've been able to partner with Nutridyne. I was about, let me do the numbers, maybe almost 7 years ago. Nutridyne and I came full circle after working together and teaching together since 1999. I've been teaching seminars for them, and they offered me a role as their chief medical education officer. So it is my privilege and my honor to serve on their science board and to be able to help integrate some of these pieces together. If you want to track me down on social media, one of the places you can find me is under the brand Ocervita. I've also launched an entire private label line, and my entire business is built around the tools and resources that we use from that functional perspective. And what we're going to do today just really leverages the root cause approach, which is not only what I teach, but it's what I teach at the level of my patients and what we've been implementing across the functional medicine and lifestyle medicine arena, I would say, for close to 20 years. So it's really helped the formation of my brand and all of my themes, my topics with patients. And my Nutridyne private labeled supplement line is all built down into these specific 5 categories. And it's kind of the way I teach my patients. I work with them in understanding root causes. And today, we're going to dig deep into this one particular theme. We're going to dig down into those roots, and we're going to really look at some of the aspects of what some of our long haulers might be experiencing and those who might have these reactivated post-viral syndromes. If you want to follow me on Facebook, I've got a private group that I bring together where we just talk about this theme. So I'm just putting this out there for those of you that might play out in the Facebook group world. You are absolutely welcome to jump into this group where I post research and articles and clinical takeaways. So please feel free to connect with me over on that side of social media. So let's get into our topic today. So if you were in private practice before 2000, you would be noting that we are in a very different state today. We have a whole different set of filters that we have to run some of our information and our thought process through. What we are seeing in this reactivation phase for many of these post-viral syndromes is a whole new lens that we need to be considering to make sure that we aren't seeing patients who might be presenting in a long hauling type situation or scenario, or who might be dealing with a particular post-viral fatigue related syndrome. So we're going to dig deep into this for the course of this next hour. So we know that the impact is huge. And why am I coming back to and looking at this unique triggering with COVID, for example, looking at the transitions from 2019 forward? It's because across the board, we have seen a change in autoimmune responses, inflammatory syndromes, chronic immune response syndromes, and elevation in MCAS patients. We're seeing more and more patients who are presenting with dysautonomias and POTS-related concerns and conditions. Across the board, it's quite fascinating to see this subgroup of conditions that is starting to emerge and starting to become more and more present in our clinical practice. Okay. So, oops, I'm seeing myself double on the screen. So that's not coming in on my end. So I'll make sure that, there we go, that's removed. So this graphic was just, it was a huge aha moment for me. This graphic gave a beautiful opportunity of being able to understand the different stages and the different timelines and some of the unique conditions and symptoms that would begin and start to present themselves. So we're all very familiar of the era before someone met this unique virus, this very unique virus presenting itself with these spike proteins and such. We have a whole different cascade of unique patterns that we're looking for in the weeks that follow these virus runs. Now, this year here in the United States, oh my goodness, it's been waves of influenzas again and RSV, and we've been seeing peaking points of mono and Epstein-Barr. And there's a lot of interesting cross dance or cross reaction, if you would say, that plays out. And reactivations are happening for many who have old viral syndromes that are getting triggered and brought back to the surface, or a chronic inflammatory wave is being triggered at the onset of meeting one of the new variants that may be moving along or through their system or their community. So some of the things we're going to do in the session and your clinical takeaway guides, you're going to find that they're going to focus on the stages that we are now starting to see and understand. When you really step back and we look at this particular arena of long haul, it most certainly brings to the surface in clinical practice some very specific and particular areas. Okay, these particular areas, as I highlighted for you: autonomic dysfunction, cognitive dysfunction, viral persistent challenges, sleep disturbances, and this is a huge one: exercise intolerance and fatigue. I am seeing so many of my healthy younger patients, those in their 20s, their 30s, who've been athletes, high athletes, professional athletes, who are finding that within months of having had some type of maybe a cold or a rhinitis or an aching viral challenge, they're finding that activities and exercises that they had no problem performing before are now lending themselves to exhaustion and a very unique new fatigue. Interestingly, I am finding that often for many of my patients presenting, and gosh, now I've seen about 400 patients in the last year presenting as new, either long haul patients or those who have challenges coming in these classifications. What I'm finding is the dysautonomia pattern is substantial. The brain fog is really next level in clinical practice. Many are experiencing a viral persistence or a reactivation of other infections. Many presenting, many with sleep disturbances, early rising in the middle of the night. And like I said, gosh, I am just really shocked at how many healthy athletes are presenting and finding that the exercise intolerance for them is maybe their wake-up call, maybe their first moment of stepping back to say, you know what, something's not right, something's changed. So we are not going to talk about managing the active infection or any of the variants that are going around at this point. But what I do want to highlight in our clinical conversations with patients is we need to ask in the history, did you get sick at any point? And if you did you have any challenges with full recovery? right? Because depending on the population study that you are looking at or you're working through, we are seeing full recovery in anywhere from 60% up to 90% of most studies that are being tracked and followed. But we are seeing some very substantial numbers starting to present, helping us identify these phases or even eras, if you would call them, post-infection or even post-exposure. We're seeing long hauling type patterns and symptoms now presenting more than ever in patients who don't even know if at any point they were exposed to spike protein or they had any triggering or reactivation taking place from an exposure. Okay, this is an important point that we're going to come back to in this discussion today. People who didn't even know that they got infected or even that they got exposed, ending up with long hauling cascades and symptoms that respond well to treatment and care. Again, 3, 6, 9, even 12 months down the road. So for the purpose of terminology, I want to make sure that in this session, we're getting more familiar with terms that are emerging both in the literature and in clinical conversations. Right, so for the point of our discussions today and all of the nutrition cheat sheets that I've created for you, you're going to see that I'm breaking down nutrition suggestions and recommendations from the literature that break down into these 4 categories. Fundamental immune foundations that we use for prevention. We're not going to talk about that today because all of you already do this. You know how to do this. I'm just going to shine the light on some of the tools and resources that can be used for acute COVID infection care. And the bulk of our discussion today is looking at ways that we can work the differential, understand the 5 underlying driving causes that might be impacting this post-viral syndrome or this post-viral cascade, in which we may find the patient goes on to be classified as PASC, post-acute sequelae COVID, or they may go on into this term that we call long haul COVID. Right. So for those of you who specialize in functional medicine, we could step back and I could say, you know what, there's a whole entire 90-minute talk or my whole 8-hour seminar that I co-teach. It could be broken down into just a few simple like buzz terms. And that is that some of the susceptibilities and risk factors here lend to the simplicity of truly saying, look, we have leaky gut that can contribute to leaky brain, that contributes to leaky vessels. And from there, voila, we've got inflammation, we have tissue damage. The whole entire conversation could be simplified and reduced sort of down into those big epiphanies that we are seeing emerging in the literature today. So in functional medicine and integrative care, and when we are using nutrition as one of our anchors and one of our staple resources, we certainly want to know that we've got amazing tools in our toolbox to help us navigate and move forward. Now, keep in mind, I'm going to come back at the end of this talk and I'm going to hit the clinical highlights of all the formulations or tools and resources that you've got access to that you can use in the UK as well. So let's step back a minute and say, what is this long COVID, right? People are so sick of talking about COVID. They are so tired of this discussion. And I can tell you in clinical practice, it's going to be walking in your door every day. We're going to be seeing more and more of the impacts of it because now that we've moved through the era of learning how to manage and screen for the acute infection, now what we're starting to see more and more prevalent in our practices is those coming in with either the persistent symptoms or what we would call the great revealer aspects of what this unique SARS virus has done. This is interestingly a grand revealer of underlying patterns that maybe have not yet reached the surface for many. For many, their exposure load or their actual infection might bring up to the top of the surface this reactivation of old infections, or might shine a light on arthralgias, or brain fog, or fatigue syndromes, or mitochondrial compromisations, or might shine the light on and bring all the way up to the surface challenges that we're dealing with the microbiome itself. So what I find so amazing is as we look to the conventional literature over and over again, and we start to see this emerging picture of this long haul syndrome that is emerging over and over again in the literature, we see don't have a lot of treatments, don't know what to do, aren't sure of how to progress. And I can tell you in our arena of nutrition and functional medicine, by stepping back to understand what's happening at these different time blocks and in these different ways, if we can use food, nutrition, and lifestyle to manage the underlying driving factors of the long hauling inflammatory immune compromise trauma to the tissues, we can get reversals that they're just not seen in conventional care today. So we are all familiar with looking at the waves over the last 3 years of insights and details and arguments on the medical arena around what does it mean to be long hauling or what happens to somebody after COVID. We are now finding there's over 200 symptoms that are out there, and there is no agreed upon definition quite yet at this point that is being implemented on a global perspective. The numbers are staggering. When we look at the number of millions of people around the world who are suffering from post-viral syndromes, we're seeing this is yet another era that is emerging where practitioners are going to want to familiarize themselves with some of these patterns and the clinical profile. And why is this such a big deal? This publication was a huge aha moment. It's just 6 months ago. Okay, and looking at this publication that came out last year in September, here they're talking about with the long hauling patterns that people are experiencing. Just let this sink in a minute. Long COVID does not appear to be self-resolving in that sense of a spontaneous recovery or a recovery in the absence of cure or an absence of treatment. This is what we're seeing in our peers' offices. This is what we're seeing for those practices that are roundtabling and starting to discuss about their patients' progress. If you're not treating the cause, or you're not treating it at all, or you're sending patients away, not identifying their brain fog, their fatigue, their autoimmune challenges, their arthralgias, their gut disruption, their insomnia, their mood disorders, if you're not understanding the timeline and their story and how they're presenting, not only can you be missing this, but what you'll often find is that these patients aren't getting better, right? And practitioners are now starting to emerge and really lean in and talk about options. A lot of practitioners today are not sure how to find and identify the long hauling patterns in their patient base. So we do have some strong understanding over these last couple of years about some of the emerging trends that we know are increasing susceptibility to long hauling. But over on our side of the aisle in nutrition and in looking at integrative and functional medicine approaches, the root cause audience has been from day one shining the light on and really looking to see, how could the underlying driving factors that change immune signaling and host cell regulation, how could that be a big piece of not only the acute reactions that some individuals are having, but might it help us identify who may go on to develop a post-viral fatigue syndrome, right? There's some big themes that emerged, without a doubt. Some of the big themes that certainly rose to the surface was the challenges that we're seeing in immune dysregulation and chronic inflammatory storming. We now have post-infectious autoimmunity kind of front and center once again in clinical practice and working our way down our differentials. As I mentioned, POTS and dysautonomia is a substantial challenge for many of these patients who have been exposed to potentially a virus that may have reactivated or highlighted potentially mycotoxins or a tick-borne disease pattern or a previous viral load that maybe was even picked up years, if not decades earlier. And we are most certainly seeing a very important connection coming back to the cardiovascular links and these challenges that may happen throughout the cardiovascular tissue, once again, leading to hypoxia challenges, coagulatory disorders, and damage to the inside lining of the endothelial tissue. So if we want to sort of step back and say, in this post-viral era, when we start looking at some of the different symptom patterns, we want to be thinking about the immune dysregulation, the autoimmune responses, as well as what challenges viral persistence may be bringing to our patient storyline. And if there is a known exposure or there is a known infection, it's always great to drill in with that patient to talk about specific symptoms, right? And to look at the onset of different symptoms that might help us get a better sense of a long hauling that is emerging, right? I'm sure you felt the same way, but what an amazing thing in these last few years to see the conversations that include vitamin D and zinc happening on the news platforms, right? And so you as nutrition professionals, those of you who have really studied root cause application of food and nutrition care would very comfortably say, well, that loss of taste and that change in smell, we know that that's been related to the depletion of zinc loads that our patients may be presenting with either during their infection or after their infection, right? And we come to find such important roles that zinc and quercetin and some very specific agents have been playing in the uptake of supporting viral proliferation and that viral persistence, which can move from cell to cell to cell and take over what I think, we're now starting to call these zombie cells, right? These cells that have been almost paralyzed in their function because of the impact of this viral load internally. So when we're looking at the symptoms, we want to ask questions, right? We want to get very clear with, for each patient that may be presenting, do they have a story? Do they have a timeline? Do they have points of interest that we can glean to help us understand if they too are falling into one of these post-acute sequelae windows, and are their symptoms highlighting viral activation? So typically this PASC window of time is going to define that 2 to 6 months post-infection window. So kind of looking at that terminology, there's specific nutrients and approaches that can be taken. But the checklist of what you're asking for and you're clinically going to dig deeper into is fatigue, physical fatigue, mental fatigue. You're going to talk about exercise intolerance. Again, this is a huge red flag, helping you understand that this might be previously very healthy individual who could be long hauling, right? You're looking for brain fog, that foggy brain, cognitive challenges, body aches and headaches, fevers and flushes, especially light ones that just keep coming and going and coming and going. And it is quite common for many of our PASC patients to also be experiencing and dealing with waking in the night. And they're waking from the inflammation. And they're waking from some of the challenges that they're having in stabilizing their metabolic performance. And interestingly, and I'm clinically seeing this so often, joint pain that sort of come out of nowhere. For some of my patients, many of my patients, and many of those who come to the groups that I run, it is so interesting to me how many of them have a flare-up of achy, stiff joints where maybe there was an old injury, maybe even sometimes from 10, 20, 30, and even 40 years ago. So joint pain, these arthralgias kind of waking up, and if in this window of time after the infection that are basically shining the light on and letting us know, hey, we've got some immune cross signaling going on here that we want to be mindful of. And then many patients, either when infected or post-infection, will have an amplification or a new transition happening around the way their gut is behaving. And as we get into a few more of the slides and we talk about some of the studies, there is now an emerging picture that looks like an altered microbiome that makes us more susceptible to becoming PASC or long haulers. And after someone meets this infection, them then going on and having a compromised microbiome going forward. So I know that's an interesting kind of conundrum. You've got an altered microbiome that makes you more susceptible to long hauling. And then if you flip into this PASC long haul scenario and syndrome, there's also another emerging pattern that they're starting to call out in the literature that says, yeah, and your gut will be compromised and can be challenged going forward after you've had that introduction of spike protein into the system. So long haul and kind of this bleed, this sort of blend from PASC into long haul is a one that we can expect to see emerging over the course of this next year as we're getting a little bit more clarity all the time in these areas. So what I wanted to share with you is you've got a couple different tools and resources. Some of you are on with me right now, and you are present in the United States. Some of you are in the European region. What I wanted to let you know is I have tools and resources for you so that whether you are following along and looking at resources that are here in the US or you have available for your regulatory needs in the EU, I've got all of your tools and resources built out and available for you. Right. I want to give credit where credit's due. I myself suffered severely from long haul that was triggered from a cascade of exposures and reactivations. For me, it was about a year ago in which my long haul diagnosis came front and center. That was really triggered and stimulated very uniquely following my third infection with COVID. I would actually hit on my 50th birthday, June in 2022. And I can say when I look at my medical timeline and I think about my health and I think about my journey, I have never been the same since that infection. I can look back and I can see a specific change in time that happened when my immune system met that compromisation. And it was about 8 months later, I ended up in the Ovation Lab program research study that was being done to support and look at underlying root causes impacting COVID. I had the privilege of being treated and seen by Kara Parker, who is amazingly one of my peers, whom I have taught with for about a decade over at the Institute for Functional Medicine, and Dr. Patrick Hanaway and Michael Stone. And I do have to say that this team of my peers really brought to light this protocol. I was able to be in this program, rehabilitate my own long haul, and honestly, within a couple weeks, I truly felt like I got my brain back, my energy back, and my life back. I was so ill about a year ago. I lost my visual capacity, could no longer wear contacts. I've been wearing glasses, as a matter of fact, for the last year, having not had to wear glasses for about 20 years. And unpacking my functional medicine timeline and story helped reveal where some of the risk factors were present. And that is through genomic susceptibility, previous infection load, and how I was re-exposed. So I'm going to share some of that with you as we move along. If you step back and say, from a functional perspective, what is the best of the best of the best of what we now know around the drivers or the causes of the post-viral patterns walking in your door today? The two major players, the two most profound complicating factors on tissue recovery and our patients' health and wellness come down to the damage that happens in these ACE2 mediated tissues and the impact of viral persistence. These are the two leading driving factors that implement and induce some of these challenges that lend itself all the way to this downstream conversation, right? Of leaky gut, leaky brain, leaky vessels. And so we see the impact to be quite profound in how chronic inflammation and inflammatory response syndromes are provoked, how the gut is also challenged, and ultimately, down at the cellular level, how the mitochondrial performance is compromised. And if we are not able to resuscitate and revive and support the mitochondria, these fatigue syndromes persist, right? And gosh, I had the privilege of interviewing Dr. Blam this year in January, and talking with him was so fascinating on one of my Nutridyne A Fresh Start interviews. I did this one in January of this year. Dr. Bland and I spent about a half an hour just exploring and talking about how this is just the next wave of post-viral patterns. You know, that patterns like this happened previously, right? That patterns like this did occur in different windows of time over the course of the last 30 to 40 years. This just happens to be the new virus that is triggering such a unique pattern in which we've never had a virus activate the endothelial tissues and contribute to this level of vascular or endothelial damage from any other pattern before. So as much as the fatiguing is common, like, for example, the fatigue that might follow a tick-borne disease infection, or the fatiguing that might follow an Epstein-Barr infection. What is quite unique about this emerging pattern is this challenge and the concerns with the vasculature and the ACE2-mediated tissue damage. So when we really step back and we look at the big picture, there are very particular tissues impacted more than others when there has been an exposure or a reactivation that may be present. Now, again, I can thank one of my peers, absolutely one of my mentors, Dr. Patrick Hanaway, who has been working very proactively along with Lori Huffman and the Ovation Lab team to really shine the light on the sequencing and to help us understand the root causes so that we can treat each patient uniquely, getting into the clusters or the areas of susceptibility or challenges that might have set them up for their long hauling experience. So we know in the very beginning, when you're first exposed to this virus, ACE2 tissue damage happens. It's pretty widespread, and we're going to dig into the tissues with the highest level of susceptibility. I can tell you my hardest patients, the most challenging patients that I'm working with are those who also have had concussions or have experienced head injuries or concussions post-COVID, or those who are having or had dysregulation with vagal nerve response. These are some of the more challenging patients that I've actually ever seen. And I'm receiving some substantial referrals coming in from a functional neurology clinic in my area. And I am finding that these patients are so highly susceptible, our treatment and our care has to be managed very, very carefully. You know, I'm also finding patients who maybe had genetic susceptibilities around histamine, who maybe already had MCAS, right? Mast cell activation syndromes, or those who are more prone to dumping histamine and creating allergenicity responses. They too, some of my most susceptible post-COVID long haul patients who get severely reactivated from these exposures and upregulated, going on to then have to adjust treatment plans and work with them in such minute doses because their susceptibilities and sensitivities are so high. So if you are seeing MCAS, if you are seeing chronic inflammatory disorders, fatigue disorders, these become a part of that rolling domino effect downstream, originally triggered by the tissue damage, the inflammation that's occurring in those susceptible regions. And if we dig under the surface and we look at where the literature has gone, it has been a deep reveal for us to be able to see injury and immune dysregulation are truly at the heart of what we're seeing in our patients presenting with these fatigue complications. So when we step back and we look under the surface and we look at all the different tissues that may be impacted, this is just a beautiful graphic, wonderful overview, giving us an opportunity to look at, well, what downstream is the consequence of the ACE2 tissue response, and what is downstream the challenge from that unresolved inflammation and that ongoing dysregulation that occurs with that viral persistence, right? Great teaching graphic. I have to tell you, I use this picture with a lot of my new patients. We sort of step back and I give them an overview of either some of their labs or some of their symptoms, and we use this as a talking tool to be able to get a sense and help them pull together what's going on at their root cause level. This is an aha moment for a lot of my patients. I have to say, the first time I saw this graphic as well, it deepened my understanding of why some of these symptoms are presenting in this group of post-viral patients. Right? If we step back and we think about that spike proteins connection or that relationship to activating other dormant viruses, right? What we see is these tissues flagged here with your ACE2 receptor bring on the prominent symptoms that we're noting in this unique patient cascade. We see the susceptibility in the lungs, right? Really interesting case studies presenting where the dyspnea on exertion, or the coughing, the spastic coughing, or that chest pain and discomfort, so often these symptoms are not a result of an infection inside of the pulmonary pathways. This is not down in the level of the alveoli. This is not in the bronchi. What we're often finding is the cause behind the respiratory symptoms that many deal with in long haul is the damage to the vasculature, the trauma and damage to the blood vessels that are supporting and fueling and supplying the pulmonary tissue directly with oxygenated blood. It is the arterial system that is susceptible to damage, coagulation, and maybe you too have looked at x-rays of patients who came back with COVID lung right? Because COVID lung is like riddled with these tiny little coagulatory patterns that often are described as glass shards, right? As though these are glass shards all throughout the lungs. This is your tip. This is a very clear picture that you're looking at a long hauling type patient whose vasculature and coagulatory risks and endothelial tissue should be at the top of your list for therapy, not necessarily looking at pushing in oxygen, but actually looking at improving the cardiovascular tone. The brain fog is quite commonly understood, right? Because this is a mitochondrial compromisation. This is a hypoxia problem where we are seeing low levels of oxygen perfusion impacting all of the various tissues that you can see here where the light is shining deeply. And then GI, we are seeing so many GI concentrated cases where the gut lining and those beautiful cells, which should be responding and signaling and balancing our immune responses, are instead hijacked, hit with that spike protein, triggering gut challenges that weren't there before that infection load. So when we think about these ACE2 tissues, we know that this is what's driving our tissue damage. And we're seeing a whole wave of secondary dysfunction apply, right? We are also seeing that many of the persistent infections are taking place because of the SARS-CoV-2 virus or spike protein fragments being still attached to or connected to those ACE2 receptor sites, where they then jam open those pathways and allow for the cell to just continue to replicate that viral load, passing it on to another cell, onto another cell, and compromising our mitochondria, right? Paralyzing apoptosis. I think this is one of the biggest ahas around this particular pattern is how this virus turns off or halts cellular apoptosis, right? This unique virus, different than most, will shut down the ability of the cell to self-destruct, right? Cell suicide is compromised, and we end up with these zombie cells they're referred to. So do spend some time kind of working your way through this diagram. I use it with patients, and we go around the list and we talk about some of the different patterns or symptoms that maybe they're even forgot has happened, and this helps them connect the dots back to our ACE2 story. Right. So in functional medicine, we are always looking for antecedents, right? We are always looking for predisposing factors. It's going to be one of the things that our functional medicine history taking has taught us, right? So this slide as well, this study printed and published in 22, helps us start thinking about, well, what are some of the early factors that could have set the stage for an individual to end up having the development of PASC or potentially becoming a long hauler, right? And some of the things that we want to shine the light on are issues with previous autoimmune challenges, previous viral loads, and susceptibilities related to metabolic disorders, body composition challenges, and vascular fragility. We've got a much longer list that we're going to dive into together today. And then just to shine the light on this working hypothesis right now, what I have found to be a very interesting emergence in the literature and conversation within COVID clinics is how many patients have gone on to develop a PASC or long hauling clinical picture with laboratory data who don't ever remember getting infected or had a very mild infection if and when they had it. The literature does now show that the severity intensity of the infection or exposure does not constitute a connection to whether or not you become a long hauler or develop PASC. And that is the second big takeaway that we're talking about today. One, long hauling is not self-resolving if not addressed. Two, how you felt when you were sick, or if you even know that you got exposed, does not have a direct correlation over to whether or not you long haul or the severity of your long haul experience, right? There's so much data right now looking at these unique susceptible individuals. You know, one of the things that I love in my own practice, I use 3x4 genetics. I do a lot of genomic testing, nutrigenomic testing. I love working with epigenetics with my patients. And I am seeing some interesting clinical connections. In many of my long haul patients, I am finding high impact genes connected back to ACE2, glutathione challenges, inflammatory cytokine compromisations. I'm seeing for some of these patients risks related to their metabolic complications or genetic familial trends of type 2 diabetes and inflammatory storms, right? So it is very valuable to dig deep and get a sense of what might have set the stage for these unique individuals and their susceptibility, right? So viral persistence, right? This has really become the big takeaway of this long haul story. What is it that allows for someone to get exposed to a virus and get over it, right? This story that we're talking about today happens to shine a heavier light on SARS-CoV, but we see the same thing post-Lyme. We see a similar thing post-Epstein-Barr. Why is it that some individuals might present with an ongoing infection that is not resolving or self-resolving in such a short window of time? So we're certainly seeing with some of our patients who go on to have the long hauling, their challenges absolutely do come down to the way in which the virus will persist, the spike protein fragments will persist, and the downstream cascades are an activated immune response, an upregulated autoimmune challenge, and this ongoing persistence of then chronic inflammation and the stirring up of latent other infections that may be present. I think many of you have seen this in the literature now, but we are seeing there's almost like this co-binding or this co-trafficking, if you would say, between COVID activation and Epstein-Barr, HHV6, HSV. We've got this cluster of viruses who can become reactivated if someone meets the new variant or the annual pass of COVID that might be moving through their community or their exposure circle. So why do we care so much about this? Why are we still having this conversation 3-4 years later? Well, this has such a profound effect on the mitochondria. And so we have patients who are fatiguing now more than ever before 2020, right? So if we look back and our patients are presenting, telling us fatigue, exhaustion, right? Compromisation and focus, aches and pains, and you're doing the timeline and you're seeing these cascades, we want to always be thinking about cellular energy and the opportunities that we have at that deep level of mitochondrial nutrition and rehabilitation so that we can try to fire back up these mitochondria and reverse that piece of the aging process. If you want to talk about vitality and you're wanting to work an anti-aging program, your vitality is completely dependent upon the efficiency and the health and healing and resilience of your mitochondrial performance, right? There is no anti-aging without healthy mitochondria, really at the core level of this discussion post-virus, right? So we know the virus impacts the gut microbiome, impacts the mitochondria, and becomes the driving forces that continues to propagate the cognitive challenges, the gut dysregulation, and the inflammatory storms. Now, deep down at that level of the vasculature, we most certainly know that the microclotting and the challenges that are present inside of the vasculature has really brought some interesting new research to the surface, right? We're also seeing that in many long haulers, there's this interesting dance going on with reduced serotonin levels, right? And what we're finding in the literature and in many of these patients with lower or compromised serotonin production, right? What is so fascinating is that there may be strong links here to our patients who had reduced vagal, polyvagal signaling cascades, right? So there's just such important connections between the gut-brain, right? This gut-brain connection is very, very powerful, and the feed-forward cycle and how this interplays with the inflammatory cascades. Again, endothelial injury and endothelial challenge is what we're seeing in many of these post-COVID cases, especially those with the fatiguing and the chronic cough patterns. Okay, we may also see the impact specific to COVID in the GI susceptibilities, right? And again, the literature is just starting to open up this as a part of the story. In no way should we all step away at this point and say, if we just added in some B6, we threw in a few cofactors, we added a little bit of support and just kind of fed the body with a little bit of tryptophan, would that fix the syndrome? No, it's not that simple at all, right? It is not a serotonin deficiency that sets the entire cascade into play. It's a piece of the story, right? It's a piece of the puzzle, and it's a part of us trying to pull these pieces back together. Leaky gut, leaky brain, gut disruption, neuro complications and challenges, and downstream impacts affecting mood disorders. Right, so we're going to be thinking about the vasculature as an important piece of our tissue recovery. Right, for years, those of you who have been in the functional medicine and nutrition arena have been focusing on leaky gut. And what we are seeing emerging in the literature is a better understanding of the way in which we see tissue damage and the impact to that endothelial tissue supplying the neurologic tissue as it relates back to challenges with these ACE2 receptors and the provocation of the coagulatory cascades happening simultaneously. So a huge piece of our story is the leaky brain. Right? If we step back, another important emerging piece is, gosh, and all you have to do is think about 2020 and 2021, when we were all first getting exposed to this interesting new insult coming into our communities and our differential with our patients, right? As you recall, in that very first wave of patients who suffered at the hands of this new viral load, what did we see? We saw patients with obesity, hypertension, vascular disorders, type 2 diabetes at that high level of susceptibility and a higher mortality rate, right? We now understand a little bit more now why, right? We understand more now how and why those patients were more susceptible and why that mortality rate was a bit higher. Right. So we step back and we think about, gosh, how many of us have been managing these metabolically challenged patients for decades? Right. We've been looking for prediabetes, metabolic syndrome, the dyslipidemias, the elevated triglycerides. These are all things we can brilliantly treat and manage with diet and lifestyle. Right. And now here again, we are seeing this amplifier that for those who met that spike protein, there is that possibility of that challenge firing off that metabolic complication and bringing to the surface issues that have been simmering for some time, right? We definitely saw challenges in the patient population that was dealing with or was experiencing some of these other cofactors linked to weight, body composition, and inflammation. And then I have to say, this was like a huge aha for me. Did you realize that they now have identified specific connections with oral health and the severity of COVID complications? Like the health of your gingivitis, your gingiva and your periodontal tissue, the health of your mouth and your oral cavity is now on the strong list of assessments and connections with progressive long hauling, right? And for those of you who live in the functional medicine world, it should be almost a no-brainer, right? When we start to see this literature starting to unfold. The oral cavity is a brilliant resource, helping us connect our way to other patterns in the body, right? We know that infections, right, and viral loads we have known for years can impact that oral cavity level, as do bacteria and other different types of microbiota, right? The mouth has its own microbiome. And that microbiome is under investigation, and that connection is being really scrutinized and looking at, well, maybe there's different patterns of bugs living in the microbiome in the mouth and that entire GI tract that are now setting the stage and giving us a better blueprint or understanding of more susceptible patients. Right, I'm Dr. Mary Ellen Chalmers, practicing in Northern California. She has absolutely for 15 years been my go-to dentist. Brought her in to lecture at the Institute for Functional Medicine. If you have more interest in this topic, and this handful of slides is credit to her and her life's work. She is really carrying the baton and championing the conversation about this link between oral health and systemic health, and these important connections which are now reaching out into this post-viral syndrome. We most certainly know dysbiotic challenges in the mouth are reflected in systemic and autoimmune inducing challenges out there within the periphery. So the data is so fascinating, isn't it? That hypertension and endothelial risks, along with blood sugar regulation and ideal liver function, right, play this important role in this feed-forward loop with the oral health. And those hidden infections that could be present in the mouth or the jaw or down in a compromised root canal. All of these must now be thought of as we see patients who are progressively moving forward with inflammatory metabolic challenges and risk to that cardiovascular system. And this is a brilliant visual. This absolutely beautifully printed just a couple years ago, 2021, but gosh, you can spend quite a bit of time going into the center of this and looking at the role of periodontal disease and seeing that there are genetic susceptibilities, microbiome complications, host immune challenges, and environmental factors that all can play into that susceptible host and turn on either systemic inflammation, or we can see disruption of immune signaling that might present in the brain, in the joint tissue, in the lungs, might present with oncology risks, or may show up in altered microbiome that we can see impacting tissues throughout the body. So again, as you're taking your medical histories and you're thinking through the nutrition timeline, do take the time to think about the oral health, right? It's a new piece of the story that we want to continuously shine the light on. So as we dig into some of the next steps, well, what are we going to do about it, right? Now that we know these are at a root level, the factors that are really driving some of these complications, if we don't have really impactful, like sort of single silver bullet hits on this, where are we seeing some of the improvements in case transformation? Where are we seeing some of the successes? It's those who are looking at a much more holistic approach. I'm totally preaching to the choir, but it's integrating the right lifestyle, the right foods, and looking at key supplements, nutraceuticals designed to target the underlying causes. So if you're going to be looking at supporting a post-viral scenario for a patient, you're going to be treating and thinking about tissue damage, the chronic inflammation that may have resolved as a part of the viral load. You may be wanting to dig deeper or screen for or test for that viral persistence or reactivation, right? You might want to step back and dig a little bit deeper, and you might want to be thinking about Epstein-Barr, right? Very common. Tick-borne disease, HSV reactivation, HHV6, right? We see some of these old dormant viruses kind of popping back up to the surface again, right? The fatigue moving again, waking back up again, causing exhaustion, brain fog. We want to most certainly evaluate, take time to ask the right questions and consider testing if appropriate, that gut microbiome. And at the heart of recovery for these patients is mitochondrial dysfunction. It's pretty fair to say that the majority of those things are happening in most of the long hauling PASC patients. We do take our time to dig deeper to make sure that we are aware of foundational nutrition, aggressive autoimmune or molecular mimicry challenges, deeper clotting or coagulation issues, again, that hindered autophagy or cell suicide compromisations. Those reactivations of old infections can be screened for. We want to be mindful of somebody's blood sugar dance and their hemoglobin A1C and their triglyceride levels and how they've been holding their insulin sensitization, as well as looking for changes in body composition. All right, so you've got some tools in your toolbox. As I mentioned, I've got full sets converted for you that relate back to in the PowerPoint deck that all of you will have access to review as a PDF. We'll have all of your either UK terms and verbiage here, or you'll have the name of your products in the US if you are joining us today from this side of the pond, I would say. So how do we implement? Right? If you are going to work a program for a patient and you want to find out how much improvement, what are the timelines that you would expect to see these improvements, and what might be some of the things you're thinking about screening or testing for? right? So you prep the patient, screen and assess, right? And a part of that process, at least on my end, is I'm screening leaky gut. I am looking for food inflammation. I am looking for fluid triggers. I use KBMO as one of my main labs. I am also considering vitamin D and omega-3 levels. I'm looking very carefully at that EPA, DHA, and arachidonic acid cascades on many of these patients. We look at 3x4 genetics. Again, like I said, susceptibility, right? So, basically that is an important, valuable place for us to be able to shine the light on which patients might be long hauling. And then tick-borne disease, right? I'm in the Midwest. I see a lot of patients with Lyme and co-infections, which is a part of the story. This particular infection often stirring the pot and waking up some of those challenges. I order viral panels. And in my most challenging, dysautonomia, POTS, dizziness, exhaustion, fatigue, MCAS, histamine dumping patients, we're finding across the board mycotoxin burdens. And some of our most challenging patients, they are struggling with their recovery window. Their susceptibility and sensitivity is so high, many of them didn't even realize that they had a mold exposure or a mycotoxin burden on board. So in my own practice, we screen, we assess, we order appropriate labs, not every lab, we order appropriate labs based on the history. I get them started in my clinical program. I work on education with them, and I get them involved in a weekly group with other patients who are going through similar factors. So in my own practice, I am absolutely implementing the program that Ovation Lab brought forward. It is my main anchor that I am using as I'm working my patients through those steps. And what I really appreciate that is really downstream from this course is the suggestions and the recommendations for not only laboratory considerations, but the therapeutic ingredients to work with, and the opportunity to use nutrition and diet and lifestyle to change this pattern and break the cycle. So the information that you've got coming from us focuses on some of the specialty nutrition supplements that are there to directly manage the drivers of long haul COVID. Not all of these are available right now in the UK. I know that. It takes a little bit of time for things to become available. Not everything is there. But all the foundational supplements are. If you got access to all of the most important immune modulating formulations, and I included all in this discussion because it's news to use, and I want you to keep an eye on these levels developing in whatever part of the world that you are in. So in your protocol document from me, I've given you a mini cheat sheet. You're all going to get a handout that breaks things down and simplifies what might you give at which point. Now, from a food and nutrition perspective, I'm going to let you know what has been helpful is the Whole30. Okay, one of the recommendations that the Ovation Lab and the And Health team have utilized in their research is the Whole30. And for me, love that as a base, but often I'm going one step further, and I'm often integrating KBMO testing because I also want to further customize my patient's diet to be able to mitigate and minimize, if we could, their exposures to inflammatory inducing foods. Okay, so sleep. Wow, sleep has played such an interesting role in both the recovery and this clinical picture, right? So we are most certainly finding that for patients with sleep disorders who are not getting enough deep restorative sleep, that it slows down the rehabilitation. Melatonin has certainly emerged as being a therapeutic ingredient that has been key for helping patients with their recovery. Just throwing in some great tips, things I share with my patients as well who are in this program. There's a lot of things we can do to help improve our circadian rhythms and to be able to get these little rest points, these like little vagal reset moments throughout the day, humming or different levels of neuro reprogramming, breathing techniques, vagal stim devices that some of our patients might be working with. There's some high tech and there's some low tech opportunities that we can do to help reset that nervous system, right? Movement. Wow, this is such an interesting connection to COVID and long haul because so many of these patients were exercisers. They were athletes. They had like such a committed fitness life. They loved fitness. It was a part of their routine. And that started to slow down and become compromised. post-COVID, right? So we see by that 6 to 12 weeks, more challenges being present. And then as patients continue to progress and move forward, more complications and more challenges may arise. Right. So we know stress plays an important role here, especially in looking at the improvements for post-viral reset. Right. So being mindful of some of these tips and some of these connections. Now, diet-wise, I don't think there's any news to any of you here, right? But integrating a nutritionist, a health coach, somebody trained to implement a low glycemic food plan that helps reduce histamines and integrates and adds the right support for enhancing a healthy gut microbiome, that is 100% the direction that we want this type of a food plan to move forward, right? We want to support the brain, the neurotransmitters, the microbiome, our metabolic response patterns, and our overall inflammatory risks. So from a nutrition perspective and looking at nutraceuticals, the protocols that have been emerging include various different ingredients that I want you to keep your eye on that are starting to emerge in the literature, coming through as some resources for ACE2 mediated tissue response, for the viral persistence, for chronic inflammation, mitochondrial dysfunction, and gut microbiome challenges. Right, so that's the direction that we want to make sure we're simplifying our program when we're giving someone a post-viral recovery framework for their case and for their care. Right, you will find that there's a lot of emerging literature and discussions right now about rehabilitation of targeting the inside of the vasculature. Right, the rhamnus sulfate has found its way in the literature kind of front and center. It is derived from or extracted from a green algae. We are seeing quite a bit of data out here right now talking about some of the roles that this plays on leaky vessel and leaky vasculature. My understanding at all times is this is one of the formulas that there is conversations around it finding its way into the European marketplace. So I want you to be aware of these types of combinations or formulations. Hey, Gromwell root, another key factor, lithosperma, looking at that red stone root. Here we are seeing key ingredient that is supportive. Did you want to pop in?
Just to say, like, we're running out of time and we have so many questions. We have like 13 questions going. So I just don't want to miss out and for people to leave.
You got it. Got it. So let me whip through clinical protocol and we'll dive right in. Okay. So chronic inflammatory factors, tools in your toolbox, using your anti-inflammatories, your omega-3s, your D3s with K2, quercetin, and antioxidants have really stole the stage here. And make sure that the formulas you're integrating and working with bring forward mitochondrial rehabilitation support. And you know how to drive those factors and really improve the output of ATP regulation. And then on the back end, the last key components that should be a part of every program that you're driving forward, spore-based organisms. So look at different forms of spore probiotics and make sure that you're weaving in prebiotics into your program. They're going to feed the gut microbiome efficiently and effectively. So I will turn it over from there. What I wanted to share with you is you all have a deck coming to you. It's a mini deck. This was kind of my cut point. So your timing is great, or at least my timing is close. What I wanted you to see is that you all have a slide deck that's going to break down for you the strategies of what do you take, how much do you take. And so what I framed for you is a prevention program, so that you can look at the options you may want to implement when preventing, where the literature has gone with some of the infections that you might be managing, and then the steps to truly implement a PASC post-viral recovery program. How much do you take? What dose do you take? And how do you move those solutions forward? So I put all of this into a mini workbook for you, and it's converted. You either have a US version or you have a European version, and a single handout that organizes all of the nutritional therapeutic interventions, all for you on one page. And so you all have that, as well as all of the resources that are available for you if you want to look at the references. So yeah, let's open things up to questions.
Yeah, I mean, we're so lucky to get your workbooks, Christy, honestly, because it's not just the slides that you're passing us on, which we will be sending out tomorrow, but it's really generous of you, as Maria said, and it's really good for practitioners to get kind of that, okay, where do I go from here? If it's someone with a sleep issue, if it's someone with, the leaky vessels that you mentioned. So because we have so many questions, we're going to jump right in. But just to say, we've also invited Rob from Nutridyne to join us because he knows so much about some of these protocols, about the dosages, where to get them in the UK, and he has an amazing offer for us. If we sign up to Nutridyne as a practitioner, we get nearly 50% discount for the first supplement purchase. So that's very, very generous of Rob. Thank you for that. We will be putting in the link on the chat box. So please have a look. Lucia's putting in the link for the discount code and the link to sign up to Nutridyne as a practitioner. Yes, so over to you, Christy. I'm gonna, if it's science-based question, I'm gonna get to Christy, and if it's a supplement-based question, I'll ask Rob. So first question for you, Christy. What about tinnitus post-COVID? I have two clients with the same contracting COVID. One has no lasting symptoms, whilst the other one seems more of a long hauler.
I would order a multiviral panel. So what I would want to dig in and see is, are there other viruses that got activated at that same time? Often that's going to come from something either stirring up or that persistence in the inner ear. So with those types of viral trends, I would be thinking and leaning heavy into vitamin A, vitamin D, zinc, right? Those are your absolute fundamentals and most foundational. And as you get your hands on more and more of those antivirals that can help work with that tissue replication, I would continue to add those. You've got immune support, which is a great resource. I would absolutely integrate glutathione, and I would dig deep into that medical history to make sure that there isn't any mold that hasn't yet been uncovered.
Thank you. Thank you. Really great protocol. Next question for you, Christy. When you say any exposure to spike protein, would that also include via spike produced in the body? So for unknown viral or spike exposure, even in mild illness cases, would that come under the same umbrella?
Absolutely, right? And so we're seeing, interestingly, that some patients have had this chronic inflammatory storm triggered by their vaccine exposure. For others, it was the infection. And right now, the literature isn't actually showing that the long hauling correlates back to one or the other. You know, it's kind of interesting. We're just seeing it's the spike protein, ACE2 damage, and the ongoing chronic inflammatory storm that comes afterwards.
Amazing, amazing. Have you found a difference in the long haul between those who have COVID and were not vaccinated and those who've had COVID and are vaccinated?
You know what? I'm not, and I'm looking for it all the time. You know, I am. And so it's like one of the first questions, right? Is I want to sort of hear the storyline. And it is interesting because most of those who at some point, I mean, most of us have all gotten infected, whether we know it or not. It's pretty rare. Like you have to be living in a weird bubble to not have been exposed at this point, right? And, you know, it is so interesting when you go back and you take that very detailed history. When you look at how did people react to whether it was a vaccine that they brought into their life or their first infection, people in general, the exposures, whether it was vaccine-driven spike protein or the actual real infection coming around in that variant, that when they reacted bad, it is so interesting to me because those patients often have an inflammatory problem, and I'm finding other bugs in them. I'm finding something else that's triggering that viral persistence. So in those cases, it's hidden Lyme, it's an old Epstein-Barr, or it's mycotoxins in my own practice for most of those patients.
Amazing, amazing. I mean, we've had a lot of questions. Even Anisha has asked about, you know, recovering post-viral, post-spike. So I hope that that's kind of answered some of those questions that we've had. Do you have any, Antra's asking, is there any specific recommendation for low white blood cell count, particularly after COVID? She's had a lot of patients that she's noticing with a low white blood cell count. And if so, what would you recommend?
I would have that be your main trigger, that if you haven't yet run a mold test, I would do a mycotoxin test and I would do a multiviral panel. If the history allows that maybe the regions where this individual has lived could also offer tick-borne disease, I would consider that profile as well. For those of you that might be stateside watching, those labs that I'm typically using here, Vibrant Lab, Vibrant Health, we use Rupa for a lot of our distribution. those are all great resources and ways for you to be able to get testing and screening. Vibrant Wellness has a fabulous tick-borne disease 2.0 panel that's all the viruses and all the tick-borne co-infections all in one finger prick. So you may want to be sort of looking at some of those resources to rule in or out other exposures that could have been there.
Thank you, Christy. That's so interesting. And speaking about tick-borne, we actually have an event next Tuesday on tick-borne diseases and infections. So please do register for that webinar next week if you're concerned about this point as well. So really, really interesting. Ruxana saying she's really looking forward to the slides. How does all of this impact male and female hormones?
Hi, Roxana. I saw that question. I love that question. You know what? There's a whole bunch of we don't know right now. And it is such an interesting piece, right? Because all you have to do is be interviewing women, specifically I can answer that for women who were menstruating before they got COVID. And many of them either stopped menstruating or had delayed menses. That infection, I told you, that third intense worst infection load I got on my 50th birthday. I never had a period ever again. That infection, I had no perimenopause symptoms whatsoever. For me, that infection, last menses I ever had, I never had one again, right? And so, gosh, I'm talking to a lot of OB-GYN docs and they're seeing these patterns too. I don't think we have all the answers, but what we certainly know is there is no doubt there's a level of interference in healthy hormone regularity. I am using the protocols that work with Tolavid and Arterisol along with the suite of nutrients we've been talking about. And I am seeing patients who are getting healthy menstrual regularity if their cycle was disrupted, but I haven't seen very many of us who went into early menopause get our periods back.
That's incredible.
Hormone wise, I see a lot of men in my practice. I'm just going to say all the men with long haul have infections and metabolic challenges in my practice. So I do a lot of andropause and early testosterone deficiency work. But for me right now, I don't think I could correlate or connect it back just to COVID or a post-viral syndrome.
Interesting. I mean, it's incredible, the irregularities, and it would be good to see if we find any studies around that. Question from Chrissy, interesting one. I have supported 2 young athletes with long COVID. I know that their gut was already compromised via their lifestyle, so overtraining, poor sleep, etc. Have you seen many athletes suffering chronically after COVID?
Oh, Chrissy, I love this question. Huge, because we own a gym. My husband is a Muay Thai kickboxer, grappling and MMA instructor, retired pro. And I work with the functional neurology clinic, which is all athletes, right? So I have this huge referral source myself that are these incredible athletes, right? Who were high performers. I am totally seeing these types of patterns, which it's just been shocking to me. Most of them absolutely have gut issues. So I will typically order a KBMO panel. I'm going to look at their gut barrier panel. I want to know leaky gut. I may order a microbiome test so that I get a better sense of what gut bugs are living in there. But I too am finding that if I don't manage that gut as a very important piece and the mitochondria, I really have a hard time getting those athletes back on board again. Right. So overtraining and undersleeping, like Chrissy, she nailed it. Right. Because so many of these athletes are used to going out there and just striving, right? They're professional athletes or they're high performing athletes. And so they sort of have this is how I used to do it, or I should be able to lift this much or go this far. And they're so frustrated. And I see them, they're frustrated, they're irritated, they're exhausted. They don't know why. Right. So in my young population, it's honestly the first thing I say. Are you having any exercise induced exhaustion? And one of the first things we want to do is talk about parasympathetic reset, right? Working on that vagal tone. Great programs out there. Obviously Gupta, the Gupta program is amazing. Annie Hopper's program is great. Primal, what's it called? Primal Impact is excellent. So vagal nerve programs are fabulous for these athletes, right? It helps them continuously work on that vagal reset process. And it's so important for their athletic career. to be able to know how to flip out of that sympathetic, go more parasympathetic, and get that vagal tone reestablished once again. I love that topic. Sorry, I could
That
like.
is, yes, I
love
can
the
see the
question.
passion. I can see the passion. And in terms of the protocol, because I can see here that, you've given us such a, great protocol depending on, where whether it's preventative or it's a long COVID. If you had an athlete like that, what protocol would you give them in this case?
I would go straight for a mitochondrial recharge formula, and I'd be given 6 a day. If they can afford it, CoQ10, I honestly will dose CoQ10 based on their budget, right? And for these athletes, I want to try to get somewhere in that 400, 600, 800 while we're trying to rehabilitate, right? I will draw in magnesium glycinate. I will use Resolvin essential fatty acids where we've got pro-resolving mediators so that we can block inflammation and support the cell membrane and the inner membrane of the mitochondria. And so I'd say those are my big hitters for those athletes, as well as, and I don't have all of the stress formulas memorized over there, but I look at some of the adrenal or androgen supporting formulas that are going to look at helping bring down an upregulated sympathetic system. So magnesiums, there's great herbal botanicals, right, that calm down a hypercortisol dump, right? So I screen for that pattern in those athletes because I want to know where's the DHEA, where's the cortisol, and what kind of an adrenal thyroid complex or challenge might we be dealing with.
Amazing. And these products are the ones, all of these are the Nutridyne from the Nutridyne portfolio.
Yes.
Amazing, amazing. And Rob, when it comes to CoQ10, for example, do you have the dosages? Is this available in the UK? Rob, tell us a little bit more about some of these supplements.
Yeah, so the CoQ10 we sell in the 100 milligram capsules. We also do a ubiquinol as well, and then we stock both the Mito Recharge mitochondrial supplement as well as cellular energy. So we have 2 different types which complement each other. Both of those are available on our UK store and EU store. Yeah, the products that you see all here are all available in the UK store. Yeah, so
yeah,
head on over and take a look.
The label, right? It's worth looking at the label and seeing what's in there. Kind of use that as a guide. Great tools, great opportunities for really getting at the underlying patterns and then moving them through that phase so that you can eventually get them to maintenance. That's the goal. Get them to maintenance.
Get them to maintenance. Amazing. And Lucia has put in some of these product names and links on the website because there's so many, we didn't want to get too confused either. So it's nice to have them. And jumping into the similar question about the athletes, Anisha is asking, could it be that with athletes, there's a higher need to evaluate the oxidative stress and recover post-training and workouts with sleep, rest, but also looking at nutrients? So I think we kind of covered that right now.
I would say yes. And I think it's a bigger story. I think it's the hypoxia story. I think it's the tissue damage at that particular level. It's getting oxygen perfusion and cellular cleansing out of those areas and out of those tissues. So I would say the demand for antioxidants is up, right? Because the mitochondria are more susceptible. So like, for example, I'm going to lean in that case too towards like Omega Pure Complete, right? Because Omega Pure Complete is a mitochondrial recovery essential fatty acid with SPMs in it that's really Jeff Bland's brainchild, right? So here you've got a vital, provoking, mitochondrial, antioxidant, oxidative stress formula, right? All under the banner of fish oil. So my answer is absolutely, but it's an and, not an or.
Thank you, Christy. Petra, I hope we answered your question about mold exposure. That was linked to the low white blood cell count, so that was quite interesting. Cecilia is asking, could you comment on vertigo and how to minimize it, Christy?
It is my least favorite in the clinical practice. I just, on a daily basis, it makes me like have a pit in my stomach because I talk to patients every day with the dysautonomia, with the dizziness, with the lightheadedness, with the vertigo. And it is the hardest symptom to change. all the answers. What is the bane of my existence? Because I have like 20 patients with severe dysautonomia and POTS, all triggered by their exposure either to their vaccine or the infection. Okay, so I get my emotions off the table. It's hard. It is not easy to treat. I am not seeing people get better if we don't treat mold. There is mold in every one of those patients. So like, think about this patterning. Dysautonomia, vertigo, and dizziness has to do with stabilizing, right, the portions of the brain that sit right up underneath and near your palate, right? So when you're around mold, you breathe in and inhale mold, right? So mold gets into the body because you breathed in spores or dust, or you were cleaning mold and it released the severe super toxins, right? So you get this stuff in your face and up in your head. It gets up into your sinuses, back into that portion of the posterior nasal pharynx, and it just starts to sit in there, right? Which is why to treat mold, you often have to use nasal sprays with biofilm busters and antimicrobials, antibiotics, and antifungals to get at it, right? So where it sits, it just seeps mycotoxins right into the stabilizing factors that affect both the inner ear and can affect the stability of that cerebellar region, right? So the majority of these patients we find have other co-infection viruses, but the mold is what's holding them back the most. Ask concussion questions. You will not be surprised to find concussion challenges in there. So kind of coming back to the mold question, it's almost always mold is mold unless proved otherwise. Okay. Look at Neil Nathan, MD, amazing author, right? Neil Nathan writes about mold, Lyme, and chronic inflammation in this current era. Fabulous book. I give it to patients. We use it as a book club conversation. Hence glutathione, right? You want to use glutathione. That's one of the most important antioxidants to quench mold toxins. CoQ10, essential fatty acids, right? And then you do often need to step into using some of the therapeutic ingredients that bind mold and pull mold out of the body. And so again, usually you need to step up and integrate nutrition, but often in those cases, nutrition isn't enough.
So true. And the glutathione, so that would also be available as a biotoxin that you have here on the protocol.
You can use that as a powerful antioxidant. It does incredible work for mitigating mold, protecting the nervous system, helping to clear and detoxify, especially if you have a genetic profile that shows there's glutathione SNPs. It doesn't do you much good to be throwing in NAC and vitamin C and all these cofactors to build glutathione if enzymatically they can't assemble it well. Right. So jump downstream and give glutathione, or give a great, broccoli isolate, give a sulforaphane complex, give food-based medicine that's going to be able to help the body detox, eliminate, and protect the brain and the nervous system. Oops, did I freeze? Are we good? Are we on? Okay, I wasn't sure.
I think it froze. No problem. No problem. Okay. We have so many more questions, but we're going to have to take one last one because there's too many. But Christy, is it possible for us to email you some of the other questions that have come up?
Oh, absolutely. Most certainly. And there's that Facebook page. Also, there's a Nutridyne Facebook page just for Nutridyne practitioners. I'm on there quite a bit and I answer questions over there. It's called The Fresh Start with Dr. Christy. It's for Nutridyne. So when you fill in your question, just say Nutridyne UK, that's great, or wherever you are. That's another great way. And, can always send me messages in the Life of a Long Hauler group. Like, that's a great group to have this kind of chatter. It's almost all practitioners and patients with long haul, right? And I've been very selective who I let come into that group. And yeah, absolutely. We'll keep the conversation rolling. I think you can see why this is an 8-hour seminar.
Nutridyne. Is that the name of the group, Christy?
That is the name of the group.
Is that the name of the group?
It is. Yeah, absolutely.
A Fresh Start with Nutridyne. Amazing. Amazing. And Rob, so if it would be amazing for you to even send us more information on this, but as we said, if you sign up to the education portal of Nutridyne, then you can receive all of have a look at all of these amazing supplements and protocols, but also get a almost 50% off for your first purchase. And Christy, this has been literally amazing. I mean, there's so many other questions, but what I'll do is I'll email them to you. And then maybe Rob can post them on the Facebook group, and we can invite everyone to join this Facebook group as well. A fresh start with Nutridyne. Please look for it on Facebook. But what we'll do is we'll send you the link of this this Facebook group as well. I can see such amazing feedback for you as well, saying this has been so rich in information. Thank you for your time and expertise. Really fantastic webinar, great feedback, amazing presentation. And I just wanted to thank you, Christy, but also Rob, Nutridyne, to really bring this together, to not just give us a supplement protocol, but actually explain us why to use these protocols, why to use these supplements, what the dosage would be. And I think that's what we as healthcare professionals are looking for.
And anyone that wants to take a vacation, I am so excited. I am teaching a 2-day conference with Dr. Jeffrey Bland, like the old days, which is amazing. We will be in Hawaii on the Big Island. So if anybody feels like taking a vacation in about a month, we are co-teaching a 2-day back-to-back. Dr. Bland is teaching on Friday, the 22nd. I'm teaching on Saturday, the 23rd of March. And he's spending an entire day talking about neuroimmune inflammation. And then I'm spending the next day doing the 8-hour version of this, including many cases. And I'm having all of the attendees workshop their own COVID story, and they will leave with their own treatment plan finished and complete. So if anybody wants a vacation, I'll see you in Hawaii.
Wow, I love that. I love that. And anyone that doesn't want the vacation or can't go to vacation, we have an event on the 21st of March here in London. If you are living in London, please do come and see us. We're hosting an amazing event on new home testing kits. We're also hosting a webinar next week on tick-borne diseases and infections and holistic solutions to that. So please do join us. And yes, we'll be sending you all of the replay from today. We're going to be sending you Christy's presentation, which she's promised to send us right now, right after the webinar. And we'll send you her jam-packed resources, fact sheets, and guides to make sure you have everything you need for combating chronic viral persistence. Christy, it's been a real pleasure. Thank you for your time. Thank you, Rob. And please visit us again. Come back to the Nutrition Collective and share your wisdom and knowledge with us.
Wonderful. I can't give that KBMO webinar enough thumbs up too. Be there, be at that event, be there. That is one of the most important tools in my toolbox, is that point of contact testing. KBMO has changed my practice. I'd say if there's 2 kits that change the landscape of everything I do, it's KBMO and 3X4 Genetics, which I know is eventually going to emerge there as well. So gosh, don't miss it. Those are incredible.
KBMO is going to be at our 21st March event. So that's going to be really interesting that you're mentioning that, Christy.
Good, good.
Amazing.
Don't miss it. If you don't come to Hawaii, don't miss that.
Thank you. And thank you, Rob, for your generous discount to the Nutrition Collective attendees. So we really appreciate the discount from these amazing products that we didn't know about on this side of the world.
Yeah, no problem. All I will say very quickly, is that when a practitioner signs up, just wait to be approved as a practitioner, then enter the code and you will get nearly 50% off the RRP on your first purchase.
Thank you. Thank you both. Have a lovely day, evening, wherever you're in the world. And thank you for being connected to us. Have a lovely day. Bye.
Thank you, everybody.
Bye.